Health insurance reform is likely to make a big difference in New Jersey. We have about 1.2 million of our residents with no health insurance coverage, and perhaps as many as 2/3 of them, maybe more, will get coverage under reform, will be eligible. Many of them will be eligible for federal subsidies to help them buy coverage. More people will be eligible for Medicaid, the low-income, the program to give coverage to low-income residents. That'll help the whole healthcare system, which has experienced tremendous financial distress in recent years. Every year for the past several years, 3 or 4 hospitals have closed because of financial distress. Half our hospitals are operating in the red. So bringing the additional funds and additional covered lives, if you will, into the system will help the system improve. Well, at our October conference, we discussed the findings of the Commonwealth Fund Scorecard on Health System Performance. The Center works with the fund to produce that scorecard. This is the 2009 report's the second scorecard. New Jersey's ranking slipped in the scorecard down to 30th. We do particularly poorly on healthcare costs and avoidable hospital use, which is one important dimension of the scorecard. By avoidable hospital use, I mean using services late in the progression of disease when good care earlier on could have prevented that use. For example, people being admitted for complications of diabetes when that diabetes could have been managed in the doctor's office much less expensively. New Jersey does very poorly in that regard. And the conference was really about getting some ideas on the table about how we can improve in those areas. A lot of the ideas we talked about at the conference are also being talked about as part of national healthcare reform. And it's very likely, assuming reform passes, that there will be opportunities for New Jersey to pursue to reprogram the really vast sums of money coming into the state to pay for healthcare to improve incentives for better care. So the state stands really to benefit from some of the things being talked about in Washington now. New Jersey is about average when it comes to delivering health care to low-income populations, in spite of considerable efforts in this state to expand coverage, particularly for low-income children. We have about as many uninsured as a percentage as the nation as a whole. That's a terrible record for a state as wealthy as ours. And there's a lot of reasons for that, and it's not for lack of effort on the part of the state to enroll people. But it's an unfortunate record, and it's an area where a lot more work needs to be done to improve access.